What is infertility? It is defined as a 1 year of unprotected intercourse during which a pregnancy is not achieved. In the United States, 15% to 20% of all couples are infertile. This is higher in older couples. This rate has remained relatively stable since the early 1980s. Generally, there are two types of infertility. First, neither partner has achieved a successful pregnancy. Second, couples who have achieved a pregnancy previously but are having difficulty currently with conception. Estimated 25% of women will experience infertility during their childbearing years. Fecundability is the probability of achieving a pregnancy within one menstrual cycle. Fecundability of a normal couple, which is less than 35 years old, is approximately 25%. Within 3 months, 57% of couples achieve pregnancy. 6 months, 72%. Within 12 months, 85%. Within 24 months, 93% of our couples achieved pregnancy. In order to understand the fertility tests and treatments that you may be offered, it is important to understand how conception naturally occurs. First, your ovary must release or ovulate an egg, which must be picked up by the fallopian tube. The sperm must travel through the vagina into the uterus and up into the fallopian tube in order to fertilize the egg. Fertilization usually takes place in the fallopian tube. Then, the fertilized egg or embryo travels down the fallopian tube to the uterus, where it implants in the uterine lining and develops. A problem that develops in any part of this process can lead to infertility. What are the signs of infertility? In female, miscarriages are the most common indicator of infertility. Endometriosis causes the lining of the uterus to grow outside the uterus. Bacterial infection may begin around the uterus and spread to other reproductive organs. Fibroids in the uterus. Tumor in the cervix often cause stenosis or narrowing of the cervix, which is a common indicator of infertility. Ovulating before the 10th day and after the 20th day of monthly cycle. Premenstrual spotting. Menopausal symptoms. Irregular menstrual cycles are the most common indication in females that they may have some problems with fertility. Obesity is accompanied by hormonal imbalance, which affects the reproductive systems and pregnancy. In male, abnormal semen analysis, undescended testicles, or damage to scrotum and the gonads are possible indicators. Obesity or anorexia is an indication that he is infertile. To determine the sign of infertility, there are two tests, which are hysterosalpingography and laparoscopy. In hysterosalpingography, a dye injected into the vagina is monitored to check for blockage in the fallopian tubes or uterus. If disease and other physical problems are present in the ovaries, fallopian tubes, or in the uterus, infertility is suggested. This may be detected through laparoscopy. The next video will show you what is the cause of infertility.